May is Women's Health Month, and today we're joined by Dr. Roxanne Mayron to learn more about the need for increased awareness of heart conditions and how to be an advocate for medical care.
Heart disease is the #1 cause of death in women across the globe, and especially right here in the United States. Unfortunately, the awareness that heart disease is the #1 cause of death is lagging and is not doing well, especially with regard to aortic valve disease. Aortic valve is the most important valve in our bodies, supplies blood to the rest of the body straight from the left side of the heart. Thickening of this valve can result in aortic stenosis, a condition, if left untreated, a fatal one. So it is really, really important for women to be heard, to be listened to be diagnosed if they have this condition, and to be treated. We have so many treatment options now, especially knowing a lot of information with the clinical trials that we have done. Most importantly, we have learned now that a lesser invasive treatment of aortic valve disease with aortic stenosis is able to be performed and no longer surgery is required. Women can have their aortic valve treated with a transcatheter approach, going from the leg and placing the valve in its position in a procedure called TAVR. We also have really good data now, especially in women who have a small annulus, a small aortic valve annulus, where we know which one of these valves is a better valve for them. So there is a lot of information, and it is really important for women to understand that they matter. They must advocate for themselves. They must make sure that if they're having the symptoms of shortness of breath, chest pain, syncope, which is getting dizzy or passing out, that they will be seen by their doctor and demand to have an ultrasound of the heart to be sure that the diagnosis of aortic stenosis is either made or excluded. This is a very, very easy test where we could have answers. And if you have significant severe aortic stenosis associated with these symptoms, you must get treatment. And the treatment is simple. And we now know which valve you should receive because the SMART trial, enrolling over 87% women, has the answers. We know which valve is better, and that is the self-expanding Evolut Medtronic valve. For more information, please go to this website, myinteractiveasjourney.com. You will get a lot of information, and hopefully you'll make sure your doctor is listening to you and hearing you out. Thank you.